The Public Health Agency of Canada put their own partying ahead of pandemic preparedness. You won't believe how much these people spent on staff get-togethers when they should have been rounding up supplies for Canadian doctors and nurses. The Public Health Agency of Canada is a total disaster, and it took a worldwide pandemic for us to find out just how asleep at the wheel Dr. Theresa Tam's agency has been all along. We've had medical professionals testifying at House of Commons committees that personal protective equipment like masks are being rationed in Canadian hospitals. And of course, we know that's because Justin Trudeau donated Canada's strategic stockpile of medical PPE, the stockpile that is managed by the Public Health Agency of Canada, over to China to deal with their coronavirus pandemic, sometime after Canada already had its first positive case of the disease. And because of the Public Health Agency's failure to maintain Canada's strategic stockpile, the head of the agency, Dr. Theresa Tam, advised Canadians that masks were somehow not effective to prevent the spread of the coronavirus, even though Tam had access to data collected by countries who wear masks to prevent the spread of diseases. And they also wear them as a gesture of good public hygiene. Places like Hong Kong and Taiwan, places that are incidentally not on the good list with China. And now, after it's become glaringly evident to anybody and everybody that masks help, I mean, they stop the spread of the disease in hospitals, why wouldn't they stop the spread of the disease in the rest of the world? Theresa Tam says, yeah, okay, Canadians wear masks. Now, let's just set aside the number of Canadians that are sick now because they followed Theresa Tam's terrible China-centric advice. And rather, let's talk about what the Public Health Agency of Canada was doing instead of making sure Canada had an appropriate strategic stockpile of masks to deal with the pandemic, which is literally why the agency was created in the first place. You see, these people were wasting our money on parties for themselves. Just look at this from Blacklocks. The Public Health Agency of Canada, in weeks leading to the COVID-19 outbreak, spent more than $50,000 on catered staff luncheons, party snacks, and refreshments for Take Our Kids to Work Day, records show. MPs cited the agency for failing in its duty to stock up on vital pandemic supplies for doctors and nurses. I think hindsight, to be honest, is 2020. Dr. Howard Naju, Deputy Chief Public Health Officer, earlier told reporters, I think in the day no one could have predicted how this was going to unfold. Hang on. That's the only job of the Public Health Agency, to predict and prepare for a pandemic. So if they can't do it, they should all be fired. Now let's go on. The agency, in an inquiry of ministry tabled in the Commons, said it billed taxpayers $50,748 for meals and snacks in the period from last October 1 to this past February 18. Expenses were billed as refreshments, working breakfasts, working lunches, and working meals for managers at the agency's Ottawa headquarters and National Microbiology Laboratory in Winnipeg. Billings with a single Winnipeg caterer, the Chatty Eatery, totaled $3,314. Expenses in the week before Christmas were $6,935, billed as, quote, meetings, and an observance of Take Our Kids to Work Day last December 20th. Agency expenses on snacks and refreshments for the entire fiscal year were not disclosed. The agency acknowledged it failed to stock up on medical supplies like hospital-grade N95 masks that sold for $1.25 at the time. Managers have refused to disclose pre-pandemic supplies held in a national emergency strategic stockpile, though the Globe and Mail on May 1st obtained documents indicated that only 100,000 N95 masks were stored before the World Health Organization declared a global pandemic. I can't give you the precise numbers, Dr. Theresa Tam, Chief Public Health Officer, told reporters May 1. What I know is it changes all the time as things come in and out. If Theresa Tam can't give us the precise numbers of masks, we need to get somebody on the job who can. It's her only job to prepare this country for a pandemic, and she obviously failed. And Canadians are dead, and Canadians are sick, and she's been giving bad advice to Canadian officials from the very beginning. don't wear masks. Oh, wait, now wear masks. Closing the border is racist. Oh, you know what? Closing the borders is effective. Thanks for nothing, Theresa Tam. Instead, Tam was busy policing anti-China rhetoric on the internet from her official government account and throwing her staff parties. We should throw Theresa Tam out. To sign our petition calling on Theresa Tam to be fired for her long list of failures, please go to firetam.com. For Rebel News, I'm Sheila Gunn Reid. To see more of our investigative journalism on Theresa Tam and the Public Health Agency of Canada, and to sign our petition calling on Tam to be fired for all of her failures, please go to firetam.com.